Yeah, so what we're proposing here is that, we're not talking about cutting the program. What we're talking about is starting with where the states are right now and then moving to a more predictable growth rate. So this will provide predictability for both the states and the federal government. And so right now what we have going on between the states and federal government is every time the states want to make a change, they have to come to the federal government to ask for permission. And we have to review every single one of their changes. It takes us almost 6 months to review even a routine change. And so going forward, by putting the program on a more predictable budget pathway, this way we know that we can actually turn the conversation away from finances to actually start talking about how we can improve care for the beneficiaries. These are people that don't have a place to turn. These are folks that are going to be on the program for the long term, our disabled population, poor children, pregnant women. So we need to start thinking about this program and how we can try to improve the outcomes, because right now this program is not performing well.
You know what I always worry about, administrators? We do this all the time, and the media collectively, that it would include me, then we are part of the problem in that we misstate what are cuts. A cut would be going from this amount to a lesser amount. Then we do the same pretty much when it comes to, trying to revamp the health insurance law. When we talk about 24 million people who'll do without insurance, when it's 11 or 12 million who have Obamacare now, we're basing that, I guess, on estimates about how many potentially could be affected over the next 10 years. But do we do a disservice when we play fast and loose with this data?
Yeah, well, you bring up a great point. If we look at Obamacare and they talk about the people that they covered, they actually put the majority of the people that were covered by Obamacare were put into the Medicaid program. So this is a program for disabled individuals, and here we are putting working age adults into this program while people that are disabled are on waiting lists. And this isn't even a program that is functioning well. A third of doctors won't even take a Medicaid patient, and we know that the results have not been great. So the status quo is not acceptable in the Medicaid program. I think we can do a much better job of trying to focus on improving outcomes and trying to control the program in a more sustainable way that works to actually put states in control of the program. Right now there's just this constant back and forth between the state and the federal government, and states are not in a position to develop innovative programs.
And to your point,